Welcome to Griffonomics. I want you to picture a cutting-edge pharmaceutical factory.
Okay.
Usually when we think of that, we imagine these massive, highly pressurized, incredibly expensive stainless steel vats.
Right, the classic industrial biotech setup.
Exactly.
Yeah.
We are talking about facilities that cost hundreds of millions of dollars just to build. And inside those steel tanks are millions of mammalian cells, strictly monitored for temperature, oxygen, pH, just brewing up these complex biologic medicines.
It's an incredibly delicate process, yeah.
It is. But I want you to erase that image entirely. Instead, imagine a facility where engineered carrot and tobacco cells are brewing life-saving medicine.
Carrots.
Carrots. And they are doing it inside flexible, disposable plastic bags at room temperature.
I mean, it does sound a bit like science fiction or perhaps a very strange agricultural experiment.
Right.
But what you are describing is actually one of the most disruptive manufacturing platforms in modern biotechnology today.
And that image, carrot cells in a plastic bag, that is the perfect entry point for our mission today. We are executing a granular investigative report into Protalix Biotherapeutics, ticker symbol PLX.
A really fascinating company.
Totally. We've taken a massive stack of their latest sources, so their 2025 financial filings, the 10K, their Q4 earnings calls, and a slew of recent analyst reports to really understand their fundamental transformation.
Because they've really shifted recently.
Yeah, we are looking at a company moving from a development stage biotech into an actual commercial stage powerhouse for rare diseases.
And if you are listening to this right now, whether you're an investor trying to spot value, a biotech enthusiast, or just insanely curious about the future of medicine, this deep dive really matters to you.
Definitely.
Protalix represents this fascinating intersection of biotech innovation, complex B2B financial modeling, and, as we'll get into, extreme geopolitical risk.
Yeah, that's a big part of it.
We are going to map out the mechanics of a company that is basically sitting at a massive strategic inflection point right now in early 2026.
So to understand their commercial potential, we first have to understand the literal machinery of their business. Like, how are they actually making these drugs? We have this image of the plastic bags, but what is the core innovation here?
Well, it really comes down to their proprietary technology, which they call the Protalix platform.
Okay.
Protalix is actually the first and only company to ever gain FDA approval for a complex human protein produced through plant cell-based expression in suspension.
Wait, when you say in suspension, I assume that means they aren't, like, using whole plants planted in a field somewhere.
I don't know, tractors involved.
Okay, good. So they were using just the plant cells floating in a liquid nutrient broth.
That's a crucial distinction, yeah. Now, to understand why this is such a massive operational moat, you have to contrast it with the industry standard.
The steel vats.
Exactly. Traditionally, complex biologics, which are large, really complex protein molecules, are made using mammalian cells. Most commonly, Chinese hamster ovary or CHO cells.
Right, the classic CHO cells. But I've always wondered, why is the industry so reliant on them if they require such intense infrastructure?
Basically, mammalian cells are used because they naturally fold and process proteins in a way that is compatible with the human body.
That makes sense.
But mammalian cells are incredibly fragile. They are highly sensitive to shear stress, meaning if you stir the liquid too fast, the cells literally rip apart.
Oh, wow.
Yeah. So they require highly controlled growth conditions, precise temperature, precise CO2 levels. That's why you need those massive, heavily engineered stainless steel bioreactors.
They're basically high maintenance.
Extremely. Furthermore, because they are mammalian, they are susceptible to mammalian viral contamination.
Oh, I didn't even think of that.
Yeah, if a single virus gets into that steel vat, it can ruin an entire batch, which is an incredibly costly disaster and a total nightmare for the supply chain.
Which brings us back to the carrots. By using plant cells, specifically carrot and tobacco cells, Protalix completely bypasses that viral vulnerability, right? A human virus or a hamster virus doesn't infect a carrot.
Exactly. The risk of mammalian viral contamination is completely eliminated.
That's huge.
And furthermore, plant cells are robust. They actually have a cell wall, unlike mammalian cells, which makes them much tougher.
So they don't rip apart when you stir them.
Right. Because of that resilience, Protalix can grow them in disposable polyethylene bioreactors, basically just large, sterile plastic bags, and they can do it at room temperature.
That is wild.
Yeah, there's no need for complicated monitors, cooling jackets, or all that massive infrastructure.
I love this. It's kind of like comparing the traditional CHO method to a massive, inflexible legacy industrial brewery, right?
Mhm.
You need all this heavy steel. It costs a fortune to set up, and it's incredibly hard to scale up or clean.
The downtime just to sterilize a steel vat between batches is immense.
Exactly. But Protalix is like a highly agile microbrewery, just brewing in disposable bags.
The microbrewery analogy is actually spot on.
Because if you need more product, you just hang up another bag. The horizontal scale-up is rapid, it's cheap, and because the bags are disposable, turnaround time between batches drops to zero. You literally just throw the bag away.
It fundamentally alters the unit economics of producing biologics. I mean, it allows for a simplified production process, highly flexible manufacturing, and drastically lower capital expenditure.
But I'm going to push back here for a second, because this is where the business model gets a bit confusing for me.
Okay.
If this manufacturing tech is so revolutionary and cost-effective, why isn't Protalix capturing all the upside? Like, why aren't they selling directly to patients? They give up a massive slice of the pie to partners.
Well, if we look at the life cycle of a pharmaceutical company, it really comes down to capital allocation and global reach.
Right.
Building a global commercial sales force, navigating complex insurance reimbursements in 50 different sovereign countries, dealing with localized patient acquisition that is a massive cash-burning endeavor.
It's a totally different business than growing cells in a bag.
Exactly. It takes years and hundreds of millions of dollars. So Protalix uses a B2B revenue model instead. They manufacture the drug substance using their highly efficient platform, but they partner with pharmaceutical giants for the actual commercialization and distribution.
So they let the giants do the heavy lifting of dealing with the insurance companies and the doctors.
They do. So for their Fabry disease drug, Elfabrio, they partner with Akisi. And for their Gaucher disease drug, Eloliso, they partner with Pfizer globally and Fiocruz in Brazil.
Let's drill into the economics of that for a second. I read that for the Kisi partnership for Elfabrio, Protalix sells the finished drug product to Kisi, and they get a cut ranging from 15% to 40% of Kisi's average net selling price.
Yes, depending on the territory and the volume sold.
Right. Plus, they get substantial regulatory and commercial milestones on top of that. So I guess that completely shields Protalix from the massive overhead of a global sales force. They get to focus entirely on what they do best, which is manufacturing and R&D.
It does mean lower margins on the final patient sale compared to a direct-to-consumer model, sure. But it dramatically de-risks their commercial rollout.
That makes sense.
They leverage Chiesi's established footprint in rare diseases to penetrate the market far faster than they ever could on their own.
Which brings us to the most exciting part of this story, I think. The agility of that plant-based manufacturing is exactly what allowed Protalix to engineer their crown jewel, Elfabrio, and achieve a massive regulatory win that fundamentally alters their position in the market.
Oh, absolutely.
We're talking about the massive news from March 2026.
The European Commission decision.
Yes. So in March 2026, the European Commission officially approved an every 4 weeks, or E4W2 milligram per kilogram, dosing regimen for Elfabrio in stable adult Fabry patients.
Which is a huge deal.
Huge. To put this in perspective for you, the listener, the standard of care for Fabry disease has historically been intravenous infusions every 2 weeks. That is 26 clinic visits a year. Each visit can take hours. You're missing work, you're missing school, your veins are constantly being accessed.
The logistical, physical, and frankly emotional burden of biweekly infusions is immense for a patient living with a chronic rare disease.
It's a heavy anchor. And this new approval effectively halves a patient's infusion burden down to just 13 visits a year.
Exactly.
The reduction in indirect financial costs, the travel, the time, it's literally life-changing. But I need you to explain the science to me here.
Sure.
I've heard of pegylation. I know it involves attaching polyethylene glycol chains to the enzyme. But in my mind, that's just adding microscopic plastic chains to a protein. How does a drug suddenly last twice as long in the body? Did they just double the dose and cross their fingers?
They absolutely did not just double the dose. That would be dangerous.
Okay, fair.
This brings us to what analysts are calling their pegylation alpha. Protalix isn't just producing standard enzymes, they are chemically modifying them to behave completely differently in the human bloodstream.
How so?
When you attach these polyethylene glycol or PEG chains to the enzyme, they act like a molecular shield.
A shield against what?
Against the body's own natural clearance mechanisms. This modification creates what's called steric hindrance. It essentially makes the enzyme physically bulkier and much harder for the body's own enzymes to break down.
Oh, interesting.
So it prolongs the drug's circulation time in the patient's bloodstream. But crucially, it also reduces immunogenicity.
Meaning the immune system reaction.
Exactly. The PEG chains essentially camouflage the enzyme, meaning the patient's immune system is much less likely to recognize the drug as a foreign invader and attack it.
So it survives longer because it's hiding from the immune system and resisting being broken down.
Much longer. Because of this customized chemical modification, Elfabrio has a half-life 40 times higher than its top competitor, which is Sanofi's Fabrazyme.
40 times.
Yes. Fabrazyme is largely cleared from the body within a day. Elfabrio persists. That robust stability is the underlying mechanism that allows for an every 4-month dosing schedule while maintaining stable therapeutic enzyme levels in the patient's cells.
Wow. So it's not just a convenience factor for the patient. That 40x half-life is a massive, biologically proven competitive moat.
It is the primary differentiator in a global Fabry market that is projected to reach over $3 billion by the end of the decade.
All right, so a 40x half-life and a newly approved dosing schedule sound like a commercial slam dunk.
Yeah.
But to see if it's actually working, we have to look at the cold, hard numbers of the 2025 ledger.
Let's do it.
And frankly, at first glance, the ledger looks a little bruising.
It does.
Total revenue for 2025 was $52.74 million. That is actually down 1.2% year over year from 2024, and it missed analyst consensus by about $5.24 million.
Right.
Furthermore, the company swung from a $2.9 million net income in 2024 to a $6.6 million net loss in 2025. I have to play the skeptic here.
Please do.
If Elfabrio is eating into the market and they have this massive competitive advantage with the dosing schedule, why did revenue drop and why are they suddenly losing money?
Well, the financials require context, particularly when you're dealing with B2B pharmaceutical models. This raises an important question about how revenue is actually recognized.
Okay. Break that down for me.
You have to remember, Protalix is not selling to the end patient. They are selling to Kesey and Pfizer. Therefore, Protalix's revenue is inherently lumpy.
Lumpy.
Right. It reflects bulk inventory purchases by their partners, not real-time patient demand at the pharmacy counter.
Oh, I think I see where this is going. It's essentially the bullwhip effect in supply chains.
Exactly.
Kesey's isn't buying one vial at a time. They might buy a massive stockpile in one quarter to ensure their global distribution hubs are stocked prior to a regional rollout, and order nothing the next quarter while they draw down that inventory.
That is the exact mechanism at play. The 10K explicitly states that their sales to Kesey may not be timed precisely to Kesey's actual pace of patient acquisition.
Okay.
There can be periods with no orders due to inventory destocking at the partner level. The 2025 revenue miss was entirely driven by these partner inventory fluctuations, particularly with Kesey, not a drop in actual patient usage.
That's a crucial detail.
It is. In fact, management was very clear on the earnings call, noting consistently increasing patient numbers in all active markets.
Okay, that explains the top-line lumpiness. The drug is still growing, just in unpredictable bulk orders. What of the $6.6 million net loss, though?
That loss was not a result of operational failure. It was a deliberate investment.
Really?
Yeah. The net loss was driven by a massive 51% jump in research and development expenses. They spent $19.6 million on R&D in 2025, primarily ramping up their clinical trials for their next generation of drugs.
Oh, okay.
It's important to view that loss not as cash being incinerated, but as fuel being shoveled into the engine room for future growth.
Sure, but what about their overall financial health? I mean, a loss is a loss no matter how much you dress it up as an investment. How is their balance sheet handling it?
This is perhaps the most crucial financial metric for assessing their survivability right now. They are completely debt-free.
Wait, really? Completely?
Entirely. In September 2024, Protalix fully repaid its $21.2 million historical convertible debt using available cash.
Wow. That is a huge weight off their shoulders. They aren't burning cash just to serve as interest payments anymore.
Exactly. And it sets them up perfectly for what management projects as a massive 2026 revenue leap. They are guiding for 2026 revenue to jump to between $78 million and $83 million.
That is a massive leap from $52 million. How are they getting there so quickly?
It's a two-pronged catalyst. First, they expect core commercial sales to Kesey to grow by more than 50% as the E4W dosing rolls out across Europe and captures market share.
Okay, that makes sense with the new approval.
But second, and more immediately, that European Commission approval for E4W dosing we just talked about That triggered a massive $25 million regulatory milestone payment from TZ.
Oh, wow. I think we need to pause and emphasize what an aha moment that is.
It's huge.
For a microcap biotech company to suddenly receive a $25 million cash injection, which is equal to nearly half of their entire yearly revenue, and for that cash to be entirely non-dilutive, I mean, that is a golden ticket.
It really is.
It completely protects the equity of the current shareholders while funding operations.
It is a transformative capital injection. Because of that milestone, Protalix expects to have a $50 million cash balance by April 2026.
So let me get this straight. They are debt-free, sitting on a projected $50 million cash pile, and expected to leap to $80 million in revenue. That totally changes the context of that 2025 net loss.
Doesn't it?
Yeah, that $6.6 million loss isn't a hole in the boat. It really is fuel. So what exactly is that R&D engine producing? Let's look at the horizon. What are they building with that money?
They are aggressively expanding their pipeline, moving beyond just Fabry and Goucher. The flagship clinical asset right now is PRX-115.
PRX-115, okay.
This is currently in a phase 2 trial, which they call the RELEASE study, and it is a pegylated uricase enzyme targeting uncontrolled gout.
Uncontrolled gout. I know that's a massive market segment. Something like $2 billion globally, right?
Yep, it's very lucrative.
But it is notoriously crowded. Amgen is already sitting there with a drug called Krystexxa, which is essentially the 800-pound gorilla in the room. Why is Protalix going after Goliath in such a crowded space?
Because Protalix believes they have a structural advantage. They are basically running the exact same playbook they used for Fabry disease.
Oh, I see.
Krystexxa is also a pegylative uricase. But Protalix believes their unique plant cell pegylation technology can create a fundamentally superior product.
Superior how?
They are engineering PRX-115 to achieve a wider dosing interval for refractory gout patients. If they can offer fewer infusions with equal or better uric acid reduction, they can still significant market share, just like the strategy with Elfabrio.
Stick to what you know and do it better. Widen the dosing window to improve the patient's quality of life, and the market share will follow. And they aren't stopping at gout. I saw in the 10K they also have PRX-119 in a preclinical development for NETs-related diseases. What exactly is a NET?
So NET stands for neutrophil extracellular traps. Neutrophils are a type of white blood cell, and when they encounter a threat, they can literally eject a sticky, web-like lattice of DNA and proteins to trap pathogens.
That sounds like a superpower.
It is until it goes wrong. In some diseases, these webs get out of control, causing severe inflammation and tissue damage. PRX-119 is designed to essentially dissolve these webs and reduce the pathological inflammation.
That is fascinating biology. But what really caught my eye in the filings is that they are also stepping entirely outside their plant cell comfort zone. They aren't just relying on carrots anymore.
You are referring to their recent partnership with a company called Sakarna?
Yes.
They are leveraging an AI platform called Oligo Creator to identify novel antisense oligonucleotide, or ASO, therapies for rare renal disorders. Wait, antisense oligonucleotide? ASOs? For you, the listener, who maybe isn't a molecular geneticist, that's essentially synthetic genetic code, right?
Yes.
It's designed to bind to a patient's RNA, acting like a molecular stop sign, preventing the body from producing disease-causing proteins in the first place.
That is a very effective way to visualize it, yeah.
Yeah.
Instead of replacing a missing protein, you're basically silencing a defective gene.
Right.
But finding the exact sequence of RNA to target out of millions of possibilities traditionally takes years of blind, grueling trial and error in a lab.
Which is where the artificial intelligence comes in.
Exactly. The AI platform, Oligo Creator, can computationally simulate millions of bindings instantly.
Wow.
It predicts which synthetic sequences will be most effective and least toxic before anyone ever picks up a pipette. It really shows Protalix's willingness to integrate advanced AI to drastically speed up early-stage discovery, moving beyond just recombinant proteins into genetic medicine. Okay, so let's step back and look at the whole picture here. With a debt-free balance sheet, an expected $50 million cash pile by April, a de-risked commercial asset in Elfabrio that is actively taking market share, and an AI-powered genetic pipeline. Protalix sounds unstoppable.
It does sound like a very strong position.
So why is the market pricing them at a massive discount compared to their biotech peers?
You've identified the core valuation disconnect.
Right. Because if you look at the analyst reports, Protalix trades at a very modest 2.8 times forward enterprise value to sales multiple. That is significantly below the healthcare sector median. For all the positive catalysts we just discussed, the market is clearly afraid of something. What is the market pricing in?
If we synthesize the skepticism from the filings and the market data, it really falls into three distinct risk buckets: geopolitical concentration, the dilution engine, and the safety box.
Let's look at the first one, geopolitical concentration. According to their SEC filings, Protalix's executive offices and their sole manufacturing facility are located in Carmiel, Israel. And as we know, the Middle East is currently experiencing significant regional conflict.
The 10K explicitly lists this vulnerability as a major risk factor. This includes the potential for rocket fire disrupting operations and the mobilization of key personnel for military reserves.
Right.
Now, impartially looking at the business mitigations, the company notes they are designated an essential enterprise by the government, meaning they get priority resources to stay open.
Okay.
And they actively store drug substance in multiple geographical locations outside of Israel to mitigate supply chain shock. But having your sole manufacturing hub in a region experiencing active conflict is a concentrated operational vulnerability that institutional investors are absolutely pricing in.
That makes complete sense. It's an objective supply chain risk, regardless of the tech. What's the second bucket, the dilution engine? I saw they sold 2.78 million shares in 2025 alone.
Well, while Protalix is debt-free, they do not participate in share buybacks. Because clinical R&D is so astronomically expensive, they have historically relied heavily on at-the-market, or ATM, offerings to fund operations.
Which means?
Basically, they issue and sell new shares of stock directly to the public to raise cash. As a result, their outstanding share count has ballooned to 80.43 million shares.
I always think of ATM dilution like paying for your house renovations with a credit card that your current shareholders are forced to pay off.
That's a good way to put it.
You know, you get the nice new kitchen, in this case the R&D pipeline, but the value of everyone's existing equity gets watered down to pay for it.
Yeah.
Now, the $25 million milestone we discussed earlier should hopefully halt that dilution engine for a while, but it's a historical trend investors just hate.
It is a painful reality of the biotech sector. Management explicitly warns in the filings that they may need to raise additional capital in the future, which would have a further dilutive effect on current shareholders.
And the third risk, the safety box.
Right. So like many complex biologic therapies, these drugs carry severe risks. Elfabrio has an FDA-boxed warning, which is the strictest safety warning issued by the FDA, specifically for hypersensitivity and anaphylaxis during infusion.
Okay, that's serious.
It is. Additionally, their gout candidate, PRX 115, saw a treatable anaphylactic reaction in its phase 1 trials. Severe adverse events can limit commercial uptake or trigger regulatory hurdles.
Because doctors might hesitate to prescribe it.
Exactly. Investors are always wary of the black box stigma because safety concerns can derail a drug even if it is highly efficacious.
So we have a company with genuinely revolutionary manufacturing technology and a de-risked commercial asset, but facing very real-world constraints in geography, dilution, and biologic safety.
That's the balance, yes.
Let's bring this home. When you weigh the catalysts against the risks, what is the final verdict on Protalix?
Despite the very real geopolitical and dilution risks we just explored, the analyst consensus currently rates the stock a BUY.
Oh, interesting.
Yeah, they categorize it as having a revenue-driven growth profile. When you look at that 2.8x EV sales multiple, it represents a significant value disconnect.
Because they have so much going for them right now.
Exactly. You have a company with a de-risked, commercially approved asset in Elfabrio, a massive $25 million non-dilutive cash injection, and a revolutionary manufacturing platform that has been fundamentally validated by global regulatory bodies like the FDA and the European Commission.
It is a fascinating setup. But before we sign off, what is the biggest unanswered question here?
Well, I want to leave you with one final thought to ponder, something that steps outside their current rare disease pipeline entirely.
Okay, I'm listening.
We've spent this entire deep dive talking about Fabry, Goucher, and gout. But if Protalix has successfully proven on a global regulatory stage that they can manufacture incredibly complex human proteins inside disposable plastic bags using resilient plant cells at a fraction of the traditional infrastructure cost, what happens if they license this Protalix technology to produce mainstream biologics?
Oh, wow. You mean beyond rare diseases, like producing the massive multi-billion-dollar mainstream drugs?
Exactly. Could the future of the entire global pharmaceutical supply chain eventually bypass fragile mammalian cells entirely? Could the blockbuster immune therapies and oncology drugs of tomorrow all be brewed in plastic bags with carrot cells?
That is a wild thought.
It's a question that really makes you rethink the physical landscape of biotech manufacturing.
From massive, multi-million-dollar stainless steel vats to a disposable bag of plant cells. The true microbrewery of the future. Thank you for joining us on this deep dive into the machinery of tomorrow's medicine. Risk defined, portfolio protected.